Okay, screen share. Hi, good morning, everyone. This is Marvin from EUTF. Thank you for joining us today at our open enrollment informational session. Along with me, I have Kali Pu Hao. He's my colleague. He'll be answering questions for you folks. So if you guys have any questions throughout this presentation, just feel free to write it in the comments. We'll try to answer it. And if it is a question that keeps popping up, we'll announce it vocally through this. But other than that, he'll just write it in the comments or whatnot. Okay, so let's go ahead and get started here. Um, so again, thank you for joining us. I know times have been kind of rough, especially for teachers or whatnot. So hopefully this open enrollment will shed some light on your health insurance information. If you guys thinking about, switching plans, hopefully this helps you to kind of make a better informed decision. Okay, so let's go ahead and get started. Okay, so this is just the agenda for today. We'll be talking about open enrollment. We do have online resources, so I'll talk to you guys about that. Plan changes. So I'll talk about the plan changes every year. There's certain changes. I'll go over that. Health plan selection. So kind of go over how to select a proper plan for you and your family. Enrollment forms. So how to fill out the form if you are going to make any changes. And then we'll wrap it up with money saving tips and wellness programs. Okay, so first off, I want to go over the important dates. Okay, so the election period is from April 1st to April 30th. If you are going to make changes, you have to submit a EC1 form. Okay, so EC1 form is the form that you will submit to personnel. Okay, some of you folks are going to need to submit a EC1H form. Okay, so those are for the HSTA VB members. Okay, they're those grandfathered in teachers. If you're not sure if you're enrolled into HSTA VB or not, you just have to call our office, or maybe even personnel can let you know. But if you're a fairly new teacher, you're probably just gonna fill in the EC1 form, okay? Because that's a grandfathered in plan. Uh, required required proof documents are also required when you do any type of election during this period. So make sure that you have the required proof documents. I'll go over which ones you kind of need for certain scenarios. And then if you're happy with your plans, employees who do not wish to make changes, no action is needed. Okay, so you don't have to fill out a form if you're happy with the plan you're in. So don't worry about that. And then again, the deadline is April 30th. Okay, so the processing period is between May and June. So enrollment forms received on or before the deadline will be processed during the months of May and June. Once enrollment is processed, a confirmation notice will be mailed to the employee. Okay, so you don't have to, call our office. Hey, did you get my form? We'll send you out a confirmation notice in the months of May and June. If you don't receive a confirmation notice by, middle of June, getting kind of late to June, make sure to call our office. Okay, so then there's something wrong. But other than that, you should get a confirmation notice. Um, if an employee is not enrolling or making changes during this election period, okay, you won't receive a confirmation notice. Okay, so keep that in mind also. And then last up, the new plan year begins July 1st and continues to June 30th of the following year. All changes made during open enrollment will take effect July 1st. Okay, any health plan changes, including new premiums and rate changes, will also take effect July 1st. So again, uh, sorry, not again, but this year is a collective bargaining year. Okay, so that's when the unions negotiate with the employers to kind of see how much we'll all pay. So while that goes on, right, we can only give you kind of estimates of what your premiums are going to look like. Usually those estimates are pretty spot on. It might be off a few dollars here and there. But again, nothing is set in stone until those collective bargaining um, is, is done. And then one last thing about the important dates for state employees, the new premiums you'll see reflected on your July 20th paychecks. Okay, so that's the first time you'll see that new premium. And then for county employees, it's going to be July 15th. Okay, so let's talk about the online resources that we have. Okay, so of course, COVID-19 is a huge thing right now. So we have on our website a whole dedicated slider that talks about, COVID-19 treatment, vaccines, how your insurance plays a part in that, and of course, how to prevent the spread of COVID-19. Okay, so definitely go on our website, check that out at eutf.hawaii.gov. We are doing a virtual fair this year, so you guys are actually lucky, right? You guys get this presentation early. You guys get to watch it right now. Um, and then if you guys have some time, you guys can check out the virtual fair. Again, it'll be in April. It looks just like that. That's on the screen. So if you want to listen to this presentation again, you can do so at that time. If you want to find out new benefits from HMSA, from Kaiser, from your dental, all that good stuff. You just click on their little icons there and you can watch their presentation. Okay, so it's more user friendly. And of course, it'll have all their resources and tools all linked in. As long as you click on their logo, right? You'll kind of go over all their information. Okay, so it's a great way to get a little bit more in depth with your plans. So again, this virtual fair is going to go on from April 1st to April 30th. So of course, we know you guys teach or whatnot. So if you guys do have some free time, just go to our website, click on, whatever you need more information on, watch their videos, look at their resources and all that good stuff. Okay, we also have the active employees tab. So that tab is great for you folks. If you guys need a enrollment form, we have an open enrollment checklist to make sure that you're turning in everything that you need to. We have our active employees reference guide. So that has a lot of information, the premium contribution tables. And then we have this thing called a premium calculator. Okay, so what it does is it asks you questions. It kind of tells you what your premiums are going to look like for whichever plan you're enrolled into. Okay, and then you can actually pick up to two other plan options and it'll give you the premiums for those plans as well. Okay, so you can kind of decipher which plan you want according to the premiums. Okay, so if you want to save some money, right, you can just input a cheaper plan and see how much money you'll save. Okay, so that's a great tool. It's called the Premium Calculator. And then we also have a plan finder. The plan finder was created because folks kept on calling our office because they forgot what plan they're in. Okay, I don't know how that happens, but it happens. So we have a plan finder in case you forget which plan you're enrolled into. You just have to input the dollar amount that gets deducted from your paycheck, and then it kind of finds which plan you're enrolled into. Okay, so pretty neat tool. So all those are on our website. Just click on the active employees tab. Okay, and then we also have this pre-retirement informational session. So if you have any bad kids like I was in school and you're thinking about retiring, right? You guys can watch this pre-retirement video. It goes over all the things you need to know for when and how to apply for retirement. Okay, so we just handle the health benefits. So we just talk about the health benefits portion about retirement. The pension and all that, that's totally a different department. That's ERS. But if you guys need more information about your health benefits, how that works with Medicare, all that stuff, yeah, feel free to watch our pre-retirement informational session. We usually have like live webinars at least once a month, and then we have pre-recorded videos as well. Okay, so if you guys need information, feel free to use that. Okay, so let's talk about the plan changes for this year. So, actually, not that much changes for this year. I'll go over HMSA's plan changes first. So, effective July 1st, they're excluding the bariatric surgery for out of network benefit for ETF HMSA 7525 active employee plans. Okay, also subjected out of network mammogram screenings to the deductible for the HMSA plans, and then they added a medical nutrition therapy benefit at a standard in-network out-of-network coverage. Okay, so that's a great benefit that's been added, and they increased the member cost share to $20 per session to the plan's standard in-network coinsurance, and narrowed the eligibility criteria for the Dr. Ornish program for reversing heart disease. Okay, so those are the changes for HMSA. So not much. For Kaiser Permanente, they increased the member copayment from $10 to $20 for basic laboratory tests under the standard plan. A facility-based diabetes prevention program that ended 12/31 of last year. And then they're going to apply a $0 copayment for the following preventive screening and lab tests for members diagnosed with specific chronic conditions. Okay, so the first one is A1C testing and retinopathy screening for individuals diagnosed with diabetes, LDL testing for individuals diagnosed with heart disease, and INR testing for individuals diagnosed with liver disease and or bleeding disorders. Okay, so those are all preventative screenings. So usually preventative screenings, you shouldn't have any copays. Okay, so those are great additions to your plans as well. CVS prescription drug changes, they increase the maximum out of pocket under the 7525 plan. Usually that happens every year. So for a single person, it's $3,150. For a family, it's $6,300. They excluded Glumensa and Fortament and their respective generic formulas. So if you are taking those, make sure to talk to your doctor. You should have got some type of correspondence in the mail as well. And they added coverage for exumenstein and uh, anatrozole. I think that's how you pronounce it, anatrozole. For women 35 and older, when verified that the medication is used for breast cancer prevention. Okay, so that's another great benefit that's kind of been added. And they updated the coordination of benefits for secondary card holders. Co-payments may be subject to change. Okay, and then the premiums, employers and unions are in negotiations to establish the employer-employee premium contributions. Okay, so that's kind of, they do the splits, right? Your employer will pick up like 80% of the premiums, you pay 20%. So the unions are negotiating that right now. Employee premium contribution amounts from July 1st, 2020 to June 30th, 2021 will be used until the agreement can be reached. Okay, so we'll use that same split as the past year to kind of calculate what it'll be starting July 1st. And then active employees should pay special attention to the premium rates, which will be posted in March, which it is March. Okay, so the ones from last year applied to this premiums, but again, we don't know the true splits until that collective bargaining process is finished. So keep an eye on for that. Okay, health plan selection. So we're moving along here. So these are just some things to consider. Um, what I'm going to go over next is kind of how to figure out which plan is right for you and your family. Okay, so of course you want to know what the premiums are. That's the monthly amount that you pay for the health insurance coverage. You want to know if your plan has a deductible or not. Okay, not all our plans have deductibles. Um, Basically, only one plan really has a deductible. It's the 7525 plan. It has this $300 we should all know how deductibles work, right? If you have car insurance, kind of works the same way. Okay, so again, most of our plans don't have deductibles, but Some of them do. So you want to know what the deductible is and what the deductible is applied to, because it doesn't apply to all services. A calendar year versus plan year. Most of the medical benefits, okay, it renews on a calendar year, right? From July 1st through December 31st. But some benefits renew on a plan year, which is July 1st to June 30th. Okay, a lot of the dental and the vision benefits renew during the plan year opposed to the calendar year. Okay, so you want to be mindful of that. In-network versus out-of-network. So some of our plans, you can go in and out of network, right? You usually have to pay a higher co-insurance or copay if you go out of network, but you have that ability. Okay, some plans you can only go in network. Okay, so you want to know which plans is more flexible than others. Co-insurance versus co-payment. So co-insurance is a percentage. Okay, a lot of people use co-insurance and co-payment interchangeably, but you really shouldn't because they mean two completely different things. Okay, co-payment is a fixed dollar amount. Okay, so if you go get a service and you have a co-payment, you usually pay a fixed amount, like $20. Okay, you always pay $20 whenever you get this service. If you had a co-insurance, you would have to pay a percentage of whatever the bill is. Okay, so keep that in mind. And then last up, maximum out of pocket. That's the amount of co-insurance or co-payment and deductibles you will pay for a covered medical and prescription drug costs within a calendar year. Okay, so what is maximum out of pocket? It's there for your financial protection. Okay, just in case of a catastrophic injury or illness, what it does is it puts a cap on how much you have to spend out of pocket. You can kind of think of it like a safety net. Okay, as soon as you hit your plan's maximum out of pocket, usually that plan will pay at 100% after that. Okay, so you're not paying an arm and a leg, right? Just in case something crazy happens. Um, it resets every calendar year. Okay, so every January 1st, it resets. Okay, so keep that in mind. And then you're still responsible for taxes in some situations. Okay, so those are all our plans that we have, and that's what the plan's maximum out of pockets are for all the different plans. So as you can see, the maximum out of pocket differs from the type of plan you're enrolled into. Okay, so that first number is if you're a single person on that plan. The second number is if you have a family plan. Okay, so keep those things in mind. Okay, so if we put all those things together, I'm going to talk about how you can choose the right plan for you. Okay, so Rick is considering enrolling to either the 90/10, 80/20, or 75/25 self-only plan. So the first thing he wants to look at is the premium contribution. So how much he's going to pay out of pocket annually to be enrolled into these plans. So for the 90/10 plan, close to $6,000, okay, $5,900. For the 80/20 plan, it's $3,500. And then for the 75/25 plan, it's just $1,000. Okay, so let's give Rick a scenario. Let's say Rick anticipates 4 doctor visits during the calendar year. His doctors charge $100 per visit before insurance pays. Okay, so a total of $400 if he goes 4 times, right? So the co-insurance under the 90/10 plan is 10% out of 400, which is $40. This plan has no deductible, and the maximum out of pocket under this plan is 2,000. Okay, so he didn't hit that, right? He only spent $40 out of pocket. So it's just the annual premiums plus the co-insurance, which is $40. He'll likely spend estimated around $5,970 under that plan. Okay, let's do the same thing for the 80/20 plan. Um, 20% coinsurance of $400 is 80. There's no deductible. He didn't hit this plan's maximum out of pocket either, right? It's 2,500. So it's just the coinsurance plus the premiums, $3,600. And then last up, 75/25 plan, a 25% coinsurance, which is $100. This plan has that $300 deductible, right? But it doesn't apply to doctor visits. Okay, so we can actually cross that out. It's just a co-insurance plus the premiums, $1,100. Okay, so the plan that saves Rick the most money in this scenario is the 75-25 plan. Okay, it saves him thousands of dollars, right? So this is a great plan if you hardly get sick, hardly get hurt. Um, if you're on a single plan, right, you don't have kids and stuff like that. Um, so this is a great plan if you hardly go doctors, or if you go doctors maybe like once or twice a year, or you get sick once or twice a year. This plan might benefit you a lot, and you could save a lot of money under this plan. Okay, so let's do the opposite side of the spectrum. Okay, so let's say Rick, he's considering enrolling into those same three plans, but this time he anticipates $19,100 in covered in-network medical expenses with the $300 deductible for that 75-25 plan. Okay, so for the 90-10 plan, what's 10% out of 19,000? $1,900. Okay. Again, this plan has no deductible and it didn't hit that 2,000 maximum out of pocket. Okay. So it's just a co-insurance, 1,900 plus the premiums, which is $7,840. Okay. So that's quite a lot already. Under the 80-20 plan, okay, there's a 20% co-insurance out of that $19,000. Okay, so that equals out to $3,800. Okay, there's no deductible under this plan, but this time that co-insurance hits that plan's maximum out of pocket. Okay, can everyone see that? This plan's maximum out of pocket is $2,500. Okay, so again, once you hit that 2,500, your plan turns into a 100% plan. Okay, so we can go back up to that co-insurance and change it. He's not going to have to pay that full 3,800. So let's change that to 2,500. Add back in the premiums for that year. It equals out to $6,000 roughly. Okay, last up, let's do the 75-25 plan. So 25%, but we also have to deduct that deductible first and then do the 25%. Okay, so this plan's maximum out of pocket is 5,000. Okay, so the co-insurance is 4,700 plus that deductible $300 actually hits this plan's maximum out of pocket right on the head at $5,000. Okay, so it's 5,000 plus the premiums for that year, which is $1,000. The annual cost would be $6,000. Okay, so the plan that saves the most money in this scenario also is the 75-25 plan. Okay, so um, it all depends, right? Because of this maximum out of pocket, it protected Rick under the 80-20 plan, and it protected him under the 75-25 plan. Okay, so that's something to consider, right? Um, Even though you're paying a lot for premiums, the 90-20 plan is not always the most financial plan, just in case you have a crazy accident or a huge medical bill. Okay, because those maximum out of pockets are there to protect you, those other plans could save you a lot of money. Okay, so something to think about if you guys are thinking about switching, right? Now's the time to switch. And the 75-25 plan looks like a great plan if you want to save some dollars. Okay, last up, we can't leave out Kaiser. So the same scenario for Kaiser. They have a comprehensive plan and a standard plan. Comprehensive plan, 3,600. Standard plan's about $1,000. Okay, if Malia was to undergo surgery, she was told the cost before insurance could be $50,000 in an in-network Kaiser facility. For the comprehensive plan, there's actually no charge. Okay, under this comprehensive plan, um, anything inpatient like surgeries or things like that, it's actually covered at no charge. You don't have to pay anything. Okay, so it's just the premiums for that year, 3,600. Under the standard plan, there's a 15% co-insurance. Okay, so 15% out of $50,000 is 7,500. Okay, but this plan has that maximum out of pocket like all the other plans. and this maximum out of pocket is 2,500. So again, we can change this 7,000 to the maximum plans or the plan's maximum out of pocket, which is 2,500, add back in the premiums for that year, which was $1,000, equals out to $3,530. Okay, so the plan that saves the most money in this scenario is the standard plan. Okay, so all these plans have maximum out of pocket, and it's kind of there to protect you. And this year, if you go with the lower end plans, you'll get great coverage and probably save some money. Okay, so it's not like this every year, but for this year it is. Okay, so enrollment forms, real quickly, I'm just going to go over the form. We all know how to fill out forms, so I'm not going to take too much time. But please ensure that you have the correct EC1 form. Okay, so it'll have the latest date possible on the bottom hand side. That's the EC1 form you want to use. It'll be on our website, so make sure that you go on our website. Don't um, get one from your friend that had it for like 3 years, right? You want to go to our website, print out the newest one. Attach all applicable proof documents, and then please submit your forms by the deadline April 30th to Human Resource Office, County Personnel, Enrollment Designee. But for you folks, you want to submit it to DOE-EBU. Okay, their address is on the top right-hand corner of the form. Okay, so I think it's a PO box. You want to submit it to the PO box, right? SASAs are good, they help out a lot, but I would not give my paperwork to them. Okay, you want to submit this directly to DOE EBU. It's really easy. Just send it to the PO box that's in the top right-hand corner of your form. Okay, you don't want to send it to somebody else and then they have to send it and then it gets lost. It's happened a bunch of times. Okay, so the EC1 form, the top section is just your employee data, so make sure you fill that in properly. Um, Coverage start date, that's the middle section of the form. You can leave that blank, okay? You don't have to put in anything there. The bottom of the form is your plan selection. So make sure that you choose only one medical and prescription drug plan. Okay, we've had forms before where someone selected the 80/20 plan and the 75/25 plan, and then we don't know which plan to put them in. Okay, so make sure you select one. Again, the life insurance is a free benefit, so make sure you always check that off. And one thing I forgot to mention about the form, always treat it like a new enrollment. Okay, what do I mean by that? Fill it out completely like you were a new hire. Okay, so on the back of the form, you have to put your dependent information. If you already had dependents on your plan, put them back on the plan. Okay, so write their names out again. I know it's kind of humbug, but it helps us do our job better, right? If we see your form and it's filled out completely, we don't have to guess if you want to keep your dependents on or whatnot. Okay, so make sure you just fill it out completely. This is for the proof documents. So for self plans, right? If you're just enrolling yourself, no proof documents are needed. If you're adding a spouse or partner, we need a copy of the marriage certificate. If it's a partner, then we need the domestic partnership paperwork. Okay, and it lists it all there. If you're adding a dependent child, we're going to need a copy of the birth certificate. If it's a guardianship, we need the guardianship decree. If it's adoption, we need the adoption decree. And then for children dependents 19 to 23 who are full-time students, for them to continue their dental and vision plans, we also need a student certification letter from the school's registrar. Okay, so it's a letter signed by the school's registrar. It's on their letterhead. Schools should know exactly what you need when you ask them about that. But if not, we have samples of it on our website. Okay, continue on the form, other insurance information. So if you have other insurances other than EUTFs, please name them there. And then you just have to sign and date the form. And then again, turn that in to DOE EBU's office. Okay, so if you're filling out anything for open enrollment, make sure you do it by April 30th. Okay, all proof documents must be received by April 30th as well. Okay, so make sure you have everything, send it all in together, or you could piecemeal it if you wanted to, but just make sure it all gets in by April 30th. Okay, and then this is just a copy of the confirmation notice. That's what it looks like. Um, it's pretty straightforward. It just kind of tells you what insurance plans you're going to be enrolled into starting July 1st. Okay, so again, if you don't get this by, May or June, make sure to call our office. Okay, some money saving tips. We're wrapping up here. Um, choose the plan that's right for you. So that's kind of like the things that we talked about earlier, right? The maximum out of pocket, the premiums, all that good stuff. Um, the cost share, picking the right providers and facilities. So your cost share, your monthly premiums, your maximum out of pocket, all those good things, and then choosing generic when available, right? So if you have a chance to do generic or brand name, always try generic first. Okay, it usually has the same ingredients and it usually costs a lot cheaper. Okay, but always check with your doctor. Sometimes brand name just works better for individuals. And then try mail order for maintenance medication. Okay, so if you have maintenance medication, it's always better to do mail order. You can get a 3-month supply for a 2-month supply cost. Okay, so you can save a lot of money there. So contact CVS or Kaiser to get started. And then wellness programs are embedded into all your folks' medical and prescription drug plans. So make sure to get your annual physicals and screenings once a year. It's always easier to treat and prevent illnesses than to treat it when it gets full blown, right? That's when it starts costing a lot of money. And then we have tobacco cessation products and programs for you smokers that are thinking about quitting. HMSA and Kaiser can help you with that. And then disease management programs. If you have chronic conditions like asthma, COPD, HMSA and Kaiser have great programs to help manage those diseases. And then health coaching. Okay, so if you're thinking about exercising a little bit more or getting on a different diet, HMSA and Kaiser have great programs to help jumpstart that. Okay, so check all those out. It's usually covered at no cost to you, so feel free to give them a call. Okay. Other than that, I think that is it. Nope, it is not. We have some reminders for you folks. So again, the deadline is April 30th. You have to fill out an EC1 or EC1H enrollment form and submit that to personnel. If you're adding dependents, again, we need proof documents. So make sure that is also submitted by April 1st. And then all changes will be effective July 1st. And then employees who do not wish to make changes, no action is needed. Okay, so just keep that in mind. But other than that, that is it for our presentation today. So again, I thank you folks for being in public service and helping educate um, our school. I know it's been a trying year or so, over a year already. But we really do appreciate the hard work, and feel free to give us a call if you guys have more information, or sorry, more questions about anything. Um, but other than that, Cully, do you have any questions um, that are common? He'll let me know if we do. But other than that, just write your comments or your questions in the comments, and then we'll try to get back to you guys as best as possible. Okay, stay safe, everyone. Thank you very much.
Yeah, we have a few questions. Lacey has a question
Oh,
regarding the HMSA HMO plan and what it is. HMO plans,
sure, sure.
yeah, go ahead.
Okay, so we do have a question here. Um, the HMSA HMO plan, what it is. Okay, so HMO stands for Health Maintenance Organization. So basically, you pick a facility. Okay, and that becomes kind of like your home base. Okay, so anytime you have to go, doctors, you'll have to go to a certain doctor, right, in that facility, and you'll kind of get all your treatments from that facility. It's usually based on a co-payment. Okay, remember is co-payments are the flat rate. Um, so like $20 is a co-payment. It's not structured on co-insurance, which is a percentage. Okay, so that's what a HMO is. It's a health maintenance organization. So you kind of pick your facility. You always have to go to that facility. If you need specialty care, that doctor kind of has to refer you to different doctors in different facilities. Okay, so that's kind of how my HMO works, and it's usually always based on a co-payment structure. So you always pay a flat rate. Usually, it's a lot cheaper um, out-of-pocket costs, but the premiums could be higher. Okay. Any other questions?
Maybe just one more. Roser has a question regarding how to enroll in her mail order for
Okay.
prescription drugs.
Okay, and then we have another question, how to enroll into mail order. Okay, so that's a great question. You would have to contact your respective drug provider. Okay, so if you have CVS, just contact CVS and they'll help you enroll because they need your information, right? And then if you have Kaiser Permanente, just contact Kaiser Permanente and they'll help you enroll. So it's really simple, and yeah, you can save a lot of money by doing mail order. So just contact them and they'll walk you through the different steps. Okay, so I think that's all the questions for today. But again, thank you guys. Thank you guys for your time and attention, and we'll see you in the next time. Aloha.